Good day. We are the Group 5 and we are here to discuss to you about choking and what you should and should not be doing in case you or someone else is choking. Well, breathing is an essential part of life. When we inhale, we breathe in a mix of nitrogen, oxygen, carbon dioxide, and other gases. But sometimes there may be tendencies where a person would not be able to gasp for air. One of the reasons for this scenario would be that the person is possibly choking. Now, choking is a blockage of the upper airway because a foreign object is lodged in the throat or windpipe, blocking the flow of air by food or other objects, which would prevent a person from breathing effectively. Now, in adults, a piece of food is often the culprit, while in young children, they would often swallow small objects. Well, choking can cause a simple coughing fit, but complete blockage of the airway may lead to death. Choking is a true medical emergency that would require fast, appropriate action by anyone available because emergency medical teams may not arrive in time to save a choking person's life. So, how would you know when a person is choking? When a person is choking, you may notice that their hands are clutched to their throat, that they are unable to talk, they are experiencing difficulty in breathing or noisy breathing. You can hear squeaky sounds when they are trying to breathe, coughing, which may either be mild or severe, their skin, lips, and nails starts to turn blue, and they would lose consciousness. Now, these are the things that you may notice when a person is choking. So let us discuss further about the kinds of choking and the necessary steps on how to save a person who's choking.
Alright, listen up. What to do if you or someone start choking. Now, I want you to pay close attention to everything we're about to show you so that you know exactly what in all kind of choking emergencies, and you're gonna share this with your friends so they might be able to help you in case you're choking. Alright, number 1, assess the situation. First of all, determine if the airway obstruction is partial or total. This will allow you to figure out what you should do to help. If the choking person can still speak, cough, or cry out, it means the airway obstruction is partial. The person can still breathe, but might get pale because breathing is obviously restricted. When the airway obstruction is total, the person won't be able to respond to you, cough, or breathe. The victim will also likely grab their throat, their fingernails, and their lips will start turning blue. This is all caused by the complete lack of oxygen. Alright, number 2, encourage them to cough. The right thing to do, if the blockage is partial, tell the person to cough. Coughing is the most effective way to clear the airways and push the stack of food out of the trachea. The best thing you can do in this situation is to calm the person down. Reassure them that everything's gonna be okay and encourage them to cough. The wrong thing to do, when some people are choking, they try to suppress a cough, straighten out their back, and breathe to their nose. This is the worst thing you can do in this situation. Drinking something while choking is not the best idea. Give the victim a glass of water once the throat is clear again.
Hi, and number 3, if the person can't cough, slap their back. Right thing to do, if the victim can't cough, the first thing to do is to stand behind them and lean them forward. You can use your knee or the back of the chair for support. Deliver up to 5 strong blows between the shoulder blades and using the heel of your hand. Be sure to direct the blows mouth instead of doing regular horizontal claps. Pause after each blow and check if it worked. This should help kick the large object out of the airway. Wrong thing to do: never administer blows to a person who's standing straight up. And don't use your fist. This will only cause the piece of food to fall deeper down and block the airway tightly. If they start to cough, stop slapping their back. And then, number 4, if the person can't breathe, perform the Heimlich maneuver. So the purpose of the Heimlich maneuver is to push out the air in the lungs that's not being used in breathing. It effectively drives out and stops out. And the right thing to do is stand behind the victim and put your arms around their torso. Clench one hand into a fist and place it on either stomach between the belly button and the lower ribs. Then cup your other hand over your fist. Now, quickly thrust your fist up towards the victim's diaphragm several times. And then keep doing this until you've cleaned the airway. And then, the wrong thing to do is don't slap the victim on the back. It can only make things worse. And make sure your arms aren't around the person's ribs, or else you're risking breaking them. Or you will risk breaking them. And then your arms should be below the ribs instead. And that's all. Thank you.
Number 5. Helping an unconscious person. The right thing to do: if the victim is passed out, lie them down on their back seat, on their hips, and face them. Put one of your hands on the top of the other, and face the base of your palm between their belly button and lower ribs. Vigorously push the abdomen towards the diaphragm. Repeat it several times until the airway is clear again. If the person does not start breathing once the object has been removed, it's time for the CPR. The wrong thing to do: do not keep the victim in an upright position. It's also a terrible idea to start during CPR before you remove the blockage from the trachea. Number 6. Helping yourself. If you're choking and starting to suffocate but there's no one around to help, you can save your own life. The right thing to do: start coughing, and if does not help, perform the Heimlich maneuver on yourself. If does not help either, bend over a chair, the corner of a table, or any other solid object at waist level and push against it as hard as you can, keeping your arms stretched out in front of you. Do this until the object becomes dislodged. The wrong thing to do: as impossible as it might seem, try not to panic. The more you panic, the more air you let in through your mouth. And incoming air will only push the stuck piece of food farther in. Do not stand up straight or hit yourself on the chest or back.
Helping pregnant women and obese people. To help people who have a bigger belly like pregnant women or obese individuals, you have to slightly modify the Heimlich maneuver. Place your hands as close to the abdomen as possible, higher than you normally would. Your hands should be right above the victim's lowest ribs. You won't able to do the regular upward thrusts, so press the chest really hard with quick thrusts instead. Repeat this procedure until the person stops choking, but don't continue if they become unconscious.
Number 9 is saving a choking child. If the victim is older than 1 year, you have to follow different rules to save them. First is stand behind the child, or if they are really small, get on your knees. Second, put your arms around the child's waist. And third, clench one hand into a fist and place it between the ribs and belly button with your thumb upwards. grasp your fist with your other hand. And lastly, move your elbows to the side and press the child's stomach with quick inward and upward thrust. Number 10. Saving an unconscious child. If the infant or child is unconscious, try laying them to their back first. First thing that you have to do is tilt their head back by lifting their chin up. Now, if you see the stuck object in the back of their throat, use your fingers to remove it. And if you have successfully removed that object, cover the child's mouth and nose with your mouth and push air into their lungs. Feel if the chest has started moving and listen to the breathing. If the child still is not breathing, if you were unable to dislodge the object from the start, begin chest compression. Remember, for small children, it will be 2 fingers pressed over the breastbone. Start doing cycles of 5 compressions and 1 breath. Call 911 if you haven't yet and keep doing CPR until they have arrived. Number 11 is saving a choking dog. To help a dog in trouble, please make sure it's really choking and not suffering from kennel cough or heart disease. If the dog is unable to swallow, drooling excessively, coughing forcefully, and acting weirdly agitated, it clearly means that the animal is actually choking. If it's still breathing alright, but clearly has an obstructions in its airway, give it a few moments to try and cough it out. If that doesn't help, open the dog's mouth with one hand on the upper jaw and on the other lower. To avoid serious injury to you, cover the dog's teeth with its lips while you grasp the jaw. Take a flashlight and look as deep down its throat as you can. If you see something blocking in the airway, carefully remove it with a set of pliers. If that doesn't work, try using back blows. The same thrust between the shoulders and blades with the heel of your hand work for both humans and dogs. About 4 to 5 sharp blows should be enough. If and only if nothing else administer the Heimlich maneuver. Hold the dog around its waist with its head pointed down. Make a fist with one hand, place it under the dog's rib cage, and cup it with your other hand. If your dog is smaller to or medium size, use 2 fingers instead of a fist. Repeat sets of 3 to 5 inwards and upward thrust. Be careful not to crack its ribs. And lastly, take your dog to the vet for a health check straight away if you manage to remove the blockage yourself.
Jean is very hungry, so she eat apple. When she starts choking. If you see someone is choking, the first step is to determine how serious it is. Choking happens when someone is not able to breathe due to a fully or partially obstructed windpipe or throat. It will often happen when food gets lodged when swallowing. If you think someone is choking, ask them, "Are you okay?" If they can reply, it means their throat is only partially blocked. They should be able to clear it on their own by coughing. However, if they cannot reply, cry, cough, or breath, then it means that their throat is fully blocked. They need your help. Have the person bend forwards and stand behind them. Use the heel of your hand, the area between the palm and the wrist, to hit them firmly between the shoulder blades up to 5 times. This creates a strong vibration which can dislodge the food. If they are still choking, give up to 5 abdominal thrusts. This is also known as Heimlich maneuver. Do not try the Heimlich maneuver on a baby under 1 year old or pregnant woman, as it can be dangerous to them. Otherwise, stand behind the person, wrap your arms around their waist, and bend them forwards. Make a fist with one hand and place it right above their belly button. Put your other hand on top of your fist, then pull sharply inwards and upwards up to 5 times. If the person is still choking after doing 5 back blows and 5 abdominal thrusts, call 999 or your local emergency number. Continue doing 5 back blows and 5 abdominal thrusts until help arrives or until their throat has been cleared. Now, Jean use fork and slowly eat apple so that she will not choke again.